Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Heart Transplantation. Introduction. A heart transplant removes a damaged or diseased heart and replaces it with a healthy one. It is the last resort for people with heart failure when all other treatments have failed. Heart transplant surgery is a life-saving measure, but it has many risks. Careful monitoring, treatment, and regular medical care can prevent or help control some of these risks. This program explains heart transplantation and heart failure. It talks about what to expect before, during, and after the surgery. It also covers risks and complications of a heart transplant. Heart failure. Heart failure is when the heart is not able to pump blood to the rest of the body at a normal rate. When the heart cannot pump all the blood it receives, fluid could back up into the lungs and other parts of the body. The lack of blood being supplied to the body and the buildup of fluids causes symptoms of heart failure. There are several levels of congestive heart failure: mild, average, severe, very severe. Problems with the heart can lead to heart failure. Some examples are coronary artery disease, diseases of the heart muscle, heart attacks, heart valve diseases, high blood pressure. Other causes of heart failure include alcohol abuse, certain cancer treatments, diabetes, HIV/AIDS, illegal drug use, thyroid diseases. Heart failure is more common in older people, but it can happen at any age. When young people develop heart failure, it is usually due to problems that patients are born with. Surgery is often needed for treatment. Mild cases of heart failure may be treated with medicines, lifestyle changes, medical procedures, but very severe cases of heart failure require a heart transplant. A heart transplant is a surgery to replace a diseased heart with a healthy heart from a deceased donor. Before the surgery. Donor hearts are in short supply. Patients who need heart transplants go through a careful selection process. They must be sick enough to need a new heart, yet healthy enough to receive it. If a heart transplant is right for a patient, they are added to a waiting list for a donor heart. Organs are matched for blood type, size of the donor, size of the recipient. Time spent on the waiting list helps decide who receives a donor heart. If two patients on the list have equal need for a heart, the one who has been waiting longer will likely get the first available donor heart. Patients on the waiting list are in close contact with their transplant centers. Patients often must arrive at the hospital within 2 hours of being notified about a donor heart. Not all patients who are called to the hospital will get a heart transplant. Sometimes at the last minute, healthcare providers find that a donor heart is not right for the patient. While you are waiting for a donor heart, you will receive ongoing medical treatment. Some patients may receive an ICD or VAD. These are devices that can help keep you healthy while you wait. You might also start a cardiac rehab program. Cardiac rehab can help improve your physical condition before the transplant. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Heart transplant. Heart transplant surgery is done under general anesthesia. You will be asleep. You will not remember the procedure. A heart transplant is done through open heart surgery. A large incision or cut is made in the patient's chest. The rib cage is then opened so that the healthcare provider can access the heart. A heart-lung bypass machine is hooked up to the body's largest arteries and veins. The machine pumps blood through the patient's lungs and body during the surgery. The surgeon removes the patient's diseased heart. The healthy donor heart is put in place and stitched to the patient's main arteries and veins. These blood vessels are not replaced as part of the surgery. When the surgery is done, the heart-lung bypass machine is removed. The incision in the patient's chest is closed with stitches. A heart transplant takes about 4 hours. Patients who receive a donor heart stay in the healthcare facility for 2 weeks after the surgery. Risks and complications. The risks of a heart transplant include those related to anesthesia and those related to surgery in general. Anesthesia is safe, but like any medicine, it can have risks. Complications of general anesthesia may include breathing problems, chipped teeth, cut lips, headache, sore throat, urinary retention. Rarely, anesthesia may cause serious complications. These include lung infections, stroke, heart attack, death. Your anesthesiologist will talk to you before your surgery. He or she will ask about any medicines you are currently taking and will explain the risks and complications of anesthesia. Your anesthesiologist will talk to you before your surgery about these risks. He or she will ask about any medicines you are currently taking. Blood clots in the legs can happen due to inactivity after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs. There they will cause shortness of breath, chest pain, and possibly death. Let your healthcare provider know right away if you experience symptoms of a blood clot. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of this complication. Surgery in general also comes with risks. Complications may include bleeding that happens during or after the surgery. Bleeding may require a blood transfusion. Infection, either deep or at the skin level. Skin scars that may be painful or unsightly. Risks and complications may also be related to this specific type of surgery. Possible heart transplant complications may include failure of the donor heart, high blood pressure, high cholesterol levels, osteoporosis. Over time, the new heart may fail. This may be due to the same reasons that caused the original heart to fail. Failure of the donor heart also can happen if your body rejects the donor heart. Rejection happens if the patient's immune system sees the new heart as a foreign object and attacks it. It is one of the leading causes of death in the first year after transplant. It is most likely to happen within 6 months of the surgery. High blood pressure happens in more than 70% of heart transplant patients in the first year after transplant. It happens in nearly 95% of patients within 5 years. High levels of cholesterol and triglycerides in the blood develop in 84% of patients within 5 years of the transplant. Other complications may also happen after a heart transplant if you do not follow your healthcare provider's instructions. After the surgery. After heart transplant, you will be given pain medicines. You will also have a ventilator and tubes in your chest. The ventilator helps you breathe. The tubes drain fluids from around your heart and lungs. Patients often must stay in the hospital for 1 to 2 weeks after the transplant. After you go home, you will need to visit a healthcare facility for regular checkups for at least 3 months. A heart biopsy may be done to show if your body is rejecting the new heart. During a heart biopsy, a tiny grabbing device is inserted into a vein in the neck or groin. The device is threaded through the vein to the new heart. A small tissue sample is taken. It is checked for signs of rejection. You will need to watch for signs of rejection after a heart transplant. Your healthcare provider will tell you what signs and symptoms to watch for. After a heart transplant, you will likely continue a cardiac rehab program. You must attend all of your medical checkups and take your medicines on schedule. You will also need to make lifestyle changes. This will include eating a heart-healthy diet. Complications of heart transplant may be controlled with lifestyle changes and medicines. After a heart transplant, you will also need to take immunosuppressants. These medicines suppress or weaken the immune system.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A heart transplant removes a damaged or diseased heart and replaces it with a healthy one. The healthy heart comes from a brain-dead donor. It is the last resort for people with heart failure when all other treatments have failed. Donor hearts are in short supply. Patients who need heart transplants go through a careful selection process. They must be sick enough to need a new heart, yet healthy enough to receive it. Patients on the waiting list are in close contact with their transplant centers. A heart transplant is done through open heart surgery. The surgery takes about 4 hours. Patients who receive a donor heart stay in the healthcare facility for 2 weeks after the surgery. You will need to watch for signs of rejection after a heart transplant. Your healthcare provider will tell you what signs and symptoms to watch for. You will also need to take certain medicines on schedule, eat a heart-healthy diet, and exercise. Heart transplant surgery is a life-saving measure, but it has many risks. Careful monitoring, treatment, and regular medical care can prevent or help control some of these risks. Thank you for using Explain.